Welcome back to Great Day Medical Monday. While the world has its eyes on one single future vaccine, pediatricians don't want parents to forget about existing proven vaccines to address other illnesses. Dr. Susan Wootton, pediatric infectious disease specialist with UT Physicians, shares how to protect our kids in today's COVID climate. Dr. Wootton, whether kids are distance learning or going back into the classroom, and that's subject to change at any given moment from district to district, now is a good time to at least just focus on some basic habits, because what we're doing today to avoid this disease is probably going to last us a lifetime.
Yeah, definitely. So we approach this new phase of school reopening. It's important to remember a few key messages, whether or not your school is open or you're doing remote or a combination. So some messages, to highlight are the importance of face masks, whether or not you're in the community or in your school, hand washing, and social distancing. And so I brought today a few face masks that we've been using at home with my kids. I have a 7-year-old and an 11-year-old. And one thing I think parents can be doing now is really working on what's comfortable. Because when we go back to school, mask wearing will probably be a part of that. This is one that my kids like a lot. It's this soft material. Maybe it's like neoprene. It's sort of stretchy and really comfortable around the ears. They also seem to like these cotton masks. These I've just found online or even at HEB. So these are really comfortable. And then this is just a straight, just cotton mask, again with the stretchy sort of earpiece. This is a mask that I wear when I'm out shopping at HEB. This has a metal wire on the top, so it fits snugly around my nose.
The bottom line with masks is that the more comfortable they are, the more likely kids in particular are going to keep them on. As an infectious disease doctor, how do you talk to your kids about this pandemic? Because I know a lot, all the movies like Fear of the Walking Dead and all that type of stuff out there, a lot of kids kind of associate with that and think, is that what's happening here? And they see on the news how many people, the death rate every day, we get that. How do you talk to your kids about it?
Yeah, and so, our kids, again, they're 7 and 11, and so I wait for them to, in many ways, lead the questions and then answer those questions that would be developmentally appropriate. We, as a family, don't watch much of the news, and so that helps me, in a way, kind of control the conversation. And so, in general, I say, most kids, do fine. They're not in the hospital and they don't get sick, but in particular with the kids, to really sort of highlight their role in sort of protecting our community. And so we spend a lot of times sort of talking about, when we're going into HEB, they need to put on their masks. And sometimes my 7-year-old doesn't want to do that. He has a really important part to play. And so we try and sort of highlight, our role in public health and what they can do to, contribute to that solution. As part of that also is being up to date for our shots. And so this summer, coincidentally, my 11-year-old was due for 11-year-old shots. And so we, marched right in there. They had a great program, got those done. And in particular, going into the fall, is the importance of our flu vaccine. And so we'll be the first in line for that.
We've seen where kids can actually get COVID. Before early on, we thought they couldn't. They can get COVID. The symptoms are generally mild, but to your point earlier, they can shed the disease. So it's important, again, that they do all their things like the washing hands and wearing the mask as well.
And social distancing, for sure. So kids are less likely to get severe illness from COVID. The symptoms that they do have tend to be, fever and cough. But you're right. So the hand washing is really important, the mask wearing, and then the social distancing.
Yeah, and other things you say that so we're not caught, off guard. For some families, if your kids are going back into the classroom and you're going back to work, you got to have a plan in place in the event that school shuts down, or the event that somebody in your family gets sick and you have to move some people around.
Yeah, and so I think to speak to that for all of us for this entire academic year is going to be, maintaining flexibility and then having good communication with our school and then our healthcare provider. And so, for example, our school is all remote for the first 3 weeks, and then they're going to reevaluate on September 8th. And so it's going to be a challenge, I think, for us to come together as a community and help each other out. Families that are creating, pods to, get small groups together. But it is going to be, I think, a bit confusing because as we've picked up, policies within districts are variable. Now, having said that, I think we're going to be learning a lot over the first even month. And so it's important just to stay really current and up to date with what your school's posting, and then information from your provider.
Yeah, and you were so right about that, because I think it became almost like a mental health issue with so many parents and so many families. Seriously, I mean, it was anxiety is through the roof, obviously, and then you add the learning part on top of that, fear of what your child's not going to learn because it's such a crazy year. And if you just take it all in stride and realize that we truly are kind of all in this together, it's like COVID generation.
And for kids overall, there was just a recent publication from CDC published on August 7th, where they looked at the hospitalization rates in kids. And overall, they're much less likely to get hospitalized than adults. And so I think, again, we're learning at a rapid speed. In the context of pandemics, we've only been at this for 4.5 months. So I think we're going to have a lot to learn.
All right, Dr. Wootton, thank you so much, and stay safe.
Yeah, thanks for having me.
And for more information on UT physicians and to book an appointment, you can call 888-4UT-DOCS. That works out to be 888-488-3627, or visit utphysicians.com.